The European Union's health agency has warned that additional cases of a new mpox variant are likely to be found in Europe in the coming days after Sweden confirmed the first infection outside Africa. Officials say the patient had been infected while staying in an area experiencing a major outbreak. On Wednesday, the World Health Organization declared a global public health emergency following an outbreak in the Democratic Republic of Congo that had spread to neighboring countries. But both the WHO and the International Federation of the Red Cross are recommending that countries do not close their borders.
From the IFRC side, we do stand with what is recommended under international health regulations, which is that there's no need to close borders when we are in disease outbreaks. Diseases don't recognize borders. People will continue to cross a border, whether it is a legal crossing or an illegal crossing. It doesn't stop a disease from spreading.
For more on this, I'd like to bring in Dr. Willam Schaffner, professor of medicine in the Division of Infectious Diseases at Vanderbilt University. Welcome. It's nice to see you. To start off, for those watching from home, how worried should people be about this outbreak?
Well, I think at the moment there's no need to worry. This is something we in public health and infectious diseases are keeping a careful eye on. We're trying to help the people in the Democratic Republic of Congo deal with this by getting them some vaccine, providing them resources so they can track these infections more carefully. I think there will be more importations, if you will, of this disease from travelers to the Congo and from the Congo and surrounding countries to other countries in Europe, the United States, Canada, and perhaps other parts of the world. But at the moment, this is not a big issue. As you have said, there's been only one importation so far to Sweden.
Now, do current vaccines against mpox work against this new variant? You said that there should be or is an effort that's ongoing to bring those to the DRC.
Yes, the current vaccines against mpox do work against this more contagious and more severe strain. The difficulty is there's only one manufacturer, and it's working overtime to produce vaccine. So it will take some time for vaccine to have an impact.
Now, in 2022, many will remember the WHO also declared a public health emergency over an outbreak of mpox. What would you say is different this time round?
There's several different things. First is there are two different strains of mpox. That was the milder strain. This one is even more contagious and it's potentially more severe. It does have a fatality rate of 1 to 2%, particularly among people who are immune compromised, older, and frail. But it is a more contagious, more easily spread strain than was the other.
Now, when you say contagious, is part of the concern the way in which it spreads?
Well, it is spread through close personal contact, often intimate and sexual contact. But sexual contact seems not to be necessary for the spread of this more contagious strain, just close personal contact. And so that makes it explain why there have been so many cases in DRC.
So from a public health perspective here, what kind of response would you recommend that governments take in order to help those in the DRC and internationally?
Well, first of all, I think we just have to be mindful, educate people who are traveling to and from the DRC and surrounding countries that they take care not to be infected, certainly not to get involved in intimate contact with local people. The other thing is we have to join together with the World Health Organization to give resources, financial, expertise, vaccine, and the like, so that the Ministry of Health in DRC has a better chance of beginning to control this outbreak.
Well, thank you so much for your time and sharing your insights with us on DW. That is Dr. Willam Schaffner with Vanderbilt University.
My pleasure.
Let's get the view from Brussels with our correspondent there, Jack Parrock. Jack, what else can you tell us about the spread of this virus?
Well, it appears to be going much faster, and that's why so many international organisations are raising concerns and looking into exactly what should be done in this instance. It's obviously shifted now, with most of the cases of this new Clade 1 strain being reported in Africa, predominantly in the Democratic Republic of Congo, where 96% of cases have been registered. Now, it's different to when the mpox virus had an outbreak across 70 countries around the world. It was mainly thought to be spread through sexual contact and mainly through the gay male community. Now it's very different, and that's what's raising concerns as well. 70% of the cases in the Democratic Republic of Congo are in children under 15, and they make up 85% of the deaths. And now, in addition to that, what's more concerning for health officials is that in that 2022 outbreak, only 1% of cases resulted in death. There were these horrible, pussy rashes that were coming up on people's bodies, but to a large extent, people were recovering from it. In this instance, this year, 14,000 cases have been registered, and there have been 524 deaths, and as I said, mainly among young children. And that's why this new outbreak of mpox is raising concerns. A lot of health officials are saying there's a number of reasons for that. Firstly, the cases are more prevalent in countries where people are poorer and have less access to health, and that the health systems in those countries are inundated, but also because this strain is more infectious, and that it's not only through sexual contact potentially, but also through any time there's broken skin contact between two people.
So plenty here to make officials sit up and take note. How are European health authorities preparing to deal with this?
Yeah, so we heard from the European Centre for Disease Prevention and Control. They sort of echoed what we heard from the World Health Organization and from the International Red Cross, saying that they don't think that travel and borders should be closed in any sense, but that they want to register and record people that are travelling back from places where there are high levels of infections. That first case that was registered in Sweden was someone who had travelled to the affected area in Africa. They said that we must be prepared for all imported cases, and they raised the risk level from low to moderate. It's clear that they're trying to keep everyone calm, that all of these health authorities are working together to do that, but to make sure that they're on top of this outbreak.
Jack Parrock for us in Brussels. Thank you so much, as always.
Tarik, Jašarević speaks for the World Health Organization. He joins us from Geneva. Tarik, we heard there that closing borders does apparently not stop a disease from spreading. But can you explain why it wouldn't limit the rate of infection, especially if proper checks are being made?
Well, as we have heard from the colleague from IFRC, and we know from the experience, and we have experience from COVID-19, that really closing the borders is not going to stop the virus. And this is a different virus from, let's say, COVID-19, because this virus is being transmitted through very close skin-to-skin contact. It can also be acquired by contacting an infected animal or through infected surfaces, but it's really primarily transmitted through skin-to-skin contact, and it's not an airborne virus as COVID-19 was. So we just need to make sure that we know who is infected and make sure that this person does not infect people around. And this is why we have called for increased vigilance, to be on alert for any possible cases, to have testing ready, to test people when we have suspicion, to look out for symptoms of mpox, and once, if there is a case being identified, to make sure that the person gets necessary clinical care, and to make sure that this person is not infecting people around.
Now, 2 years ago, the WHO also declared a public health emergency over an outbreak of mpox. In which way is this one different?
Well, broadly, there are two clades of mpox, clade 1 and clade 2. Global outbreak that happened 22-23 was driven by clade 2, that is less severe, and that was primarily being transmitted through a sexual route. then the cases, number of cases dropped down, and we lifted the emergency. Here we are talking about clade 1 that is being circulating in Africa, in DR Congo previous years, but the scale of the outbreak this year is unprecedented. And in addition to that, there is a new substrain of clade 1 that seems to be spreading fast. There are 4 countries that have reported cases, neighboring countries of DR Congo, just in the past couple of weeks. So it's a new strain. We still don't know if it's more severe than the clade 1 original one, but we have to really look on being ready, and that's why we are calling really to this international cooperation. We are triggering mechanisms for procurement of vaccines, and we are really making the same countries say, look, be on a lookout. So we can collectively stop transmission chains.
Can and should people take measures at an individual level, like we did during COVID?
No, this is a very different virus. This virus is not spread through droplets and aerosols. It's spread through skin-to-skin contact. So I think what is important that countries' health systems, first of all, are strong enough to be able to monitor and to see if there are any possible cases. If there are people with the symptoms, and symptoms are quite visible for mpox. It's a skin rash, it's a lesion on faces, on genitalia. If people come with those symptoms, they should be immediately tested and then basically provided support care and make sure that they don't have a close contact with other people. So in a way, we don't expect mpox to spread unless there are some mutations. Obviously, we never know. But at this stage, pox viruses are spreading only through very close contact.
Can you define this very close contact for our viewers? What do I need to do to get infected?
Well, what we have seen in a 22-23 outbreak, it was really primarily through sexual intercourse, and it was in a specific sexual networks, man having sex with man. But clade 1 is different. We see lots of children who are being infected by being in a close contact with their family members. So not necessarily through the sexual route, but just the skin-to-skin contact. So it's really just, again, from the public health perspective, most of these pathogens should be looked at in the same way. We need to know where the virus is, and we need to know who is infected, and then basically make sure that this person does not infect others. And for that, we need strong surveillance, we need strong laboratory equipment, and having a health workforce who can help. At the individual level, people should just follow the advice of their health authorities, and really, but the most important thing is we know where the virus is, and this is what Sweden done yesterday, being very quick in detecting the case, making sure that that person is taken care of, and making sure that there is no onward transmission.
Tarik Jašarević there with the World Health Organization in Geneva. Thank you very much.
Thank you.
Feigl-Ding is an American public health scientist, epidemiologist and chief of the COVID task force and co-founder of the World Health Network. He joins me now from Washington. Eric, we heard the Red Cross there saying borders should not be closed. Why is this time any different than COVID?
Well, thank you for having me. The borders in itself is not the most effective way. Without testing, there's no point of closing any borders. The issue is that this monkeypox, mpox, has spread very, very quickly to countries that's never been affected, even in Africa that have never had mpox. And now I think the Swedish case is just the tip of the iceberg, because we actually think it spreads much. This new version, don't ignore the previous version, this new version is much more contagious, and I think also much more severe, we believe, than previous mpoxes.
So speaking of this new version, which is dangerous enough for a global public health emergency, what sets it apart and how can people protect themselves?
Yeah, so there's several clades, several groups and variant groups. This is clade 1, which is, unlike clade 2, is much more severe. Not as severe as Ebola, but much more severe. And we think that it, because it has not been outside of Africa much. Even certain countries in Africa has never seen cases unlike this year. It's definitely, there's very few, background immunity against it. It's very different from past mpoxes. So past mpoxes in itself, we're not sure what is the relative immunity in protecting against this. And again, most of the world does not have vaccines or against mpox, and most of the world is not vaccinated against smallpox either, which is a cousin virus. So we have to be very vigilant. This is almost like a new virus that the world has not seen before. And we know that if we let down our guard, what new viruses can do to the world.
Right. So is mass vaccinations the way to go then?
Yeah, theoretically. The issue is that there are two vaccines, but they are very limited in supply. The ramp up will probably take 6 to 8 months, we believe. And that assumes that, of course, that there's willingness to ramp up and mass purchase these vaccines. So there are limited vaccines for these, but not at the global scale of production to mass vaccination. So at this current time, we can't do mass vaccination. And, we'll see how bad this gets before we consider that.
You mentioned the importance of testing earlier. China wants to screen arrivals for mpox symptoms. Is this the way to go? Are such measures needed elsewhere?
So yeah, symptomatic screening, we don't really know if that's end all and be all. We know from COVID before that we used to do symptomatic screening, but we realized 50% approximately of all COVID transmission was due to asymptomatic. So symptomatic screening was what we did at the beginning until we realized it wasn't enough. And I think this mpox, the fact that it's dangerous, but it's not so severe that you're immediately symptomatic, that suggests that we could potentially see asymptomatic or low symptomatic, like basically confusingly symptomatic, where we don't know whether it's mpox or not. So I don't think that in itself will stop. I think screening and testing is very important, of course. We have to do more testing, and many doctors aren't testing yet. But I don't think screening based on mpox symptoms alone is enough to stop the virus.
Eric Feigl-Ding in Washington, thank you so much for that.
Thank you.